Hey everybody, I want to take a minute today to talk about the journey to a diagnosis. And I don't want this to be specific to Parkinson's. I think there's really something to look at when it comes to really finding answers to any of your health questions. So, we all know like when something's wrong with our body, right? And the logical thing to do is to go see the doctor. So in my case, I've mentioned, I was having weird things happening to my hand, a tremor in my hand. So the first step is, you go to your primary care physician. In my case, I didn't have a primary care physician at the time, so I went and found one. But one thing you have to keep in mind is not every primary care physician is the same, just like not every, neurologist is the same. So how thorough the workup you get from your primary care physician is really determines a lot of the next steps that's going to happen to you. Most of us have insurance plans that require us to, get referrals to a specialist from our primary care physician. So it is really important to get a really good one and get a really thorough assessment from them. In my case, mine did a really good, actually, neurological assessment. Ordered some preliminary labs, ordered a CT scan of my shoulder, things like that, sent me to PT. But it's really up to us as patients, especially in this country, to be advocates for our own care. So when you go to your follow-up visit with your primary care physician, you can't assume anything. You can't assume that they've looked at those labs. You can't assume that they've received the report from the specialist that they sent you to. It's really important to always keep and request your own documents of all of those type of things, consultant reports, imaging reports. Most of us have access to that through some kind of patient portal, but it's always good to have it available because you can never assume anything in healthcare. They're seeing so many patients and they have so many priorities. So it's best to, gather your own information, have it readily available, make sure that you make lists of the questions that you have so that when you get there, you can really, optimize your time on that journey to a diagnosis, whatever that is. And if you're not comfortable with the answers that you're getting, to not hesitate to ask for a second opinion or even to, switch doctors. So that's just my 2 cents today. I hope this helps.